It's December 29, Ukraine Media Center continues after operation. My name is Svetlana Shaparenko, and now we are going to talk about the changes to the national immunization calendar that are supposed to take place in 2026. Let me introduce our speakers. Joining us today is Ihor Kuzin, Deputy Minister of Health, Chief State Sanitary Doctor of Ukraine. Also joining us is Ayadil Saparbekov, WHO Health Emergencies Team Lead for Ukraine. Also joining us is Kenan Madi, Head of Humanitarian Programs at UNICEF Ukraine. Also joining us is Oleg, Klots, General Manager, State Enterprise Medical Procurement of Ukraine. Volodymyr Kurpita, General Director of the Public Health of Ukraine. And also joining us online will be Fedir Lapii, Head of the National Technical Group of Experts on Immunization, Infectious Disease Specialist. So, Mr. Ihor, with the 1st of January, the new immunization calendar comes into effect. So please tell us more, what are the changes that will take place and whom are they going to be covering? Dear colleagues, thank you for having me. With the 1st of January, we're starting the new immunization calendar, and the Ministry of Health has undertaken a systemic work in cooperation with a group of technical experts on immunization, and we've renewed the national immunization calendar. The main changes will be covering 4 key categories. The first one is we're implementing new vaccines. This is the human papillomavirus vaccine. Then there will be a range of vaccines that will be applied earlier than later. It applies for measles and MMP vaccine. And then we are going to use multi-component vaccines. We will switch to application of multi-component vaccines so that every visit to the doctor gives you the best protection. It relieves the burden on the family and the average number of injections for one child. In this way, we count on having the parents, it will be easier for them to monitor the immunization calendar of a child. And the last change is that Ukraine is refusing the oral poliomyelitis vaccine, replacing it with an injected vaccine that is based on the recommendations of the World Health Organization. And it's an evidence-based practice. Those are the 4 key categories of changes, but the national calendar of immunization was also modernized in a number of ways. It was renewed, and it comes into full effect with the 1st of January 2026. So why are those changes taking place now? Why not earlier? What exactly pushed us to those changes? Well, it's worth saying that the world is not standing in one place. The new evidence-based data is emerging at the global level and at the level of European Union. There are meetings of expert groups taking place that provide countries with recommendations on relevant amendments to their immunization calendars. So basically, our national immunization calendar as of the last year is a little bit obsolete. It already requires modernization. That's why a resolution like that was taken. And thanks to the support of our foreign partners, thanks to the support of Gavi, we were able to balance the state budget in such a way that we release some resources to procure the vaccines that are being implemented starting from the next year. Thanks to this support, we've got the vaccine within the humanitarian aid programs that enabled us to release some government funds. And the resolution was made that within the year 2025, we have to renew, to modernize our immunization calendar to bring it in compliance with the European requirements. Mr. Madi, I know that there was a survey about the attitude of Ukrainians to vaccination. You have the results of that survey. Can you please tell us the way the attitude of Ukrainians to vaccination has changed recently? What is still stalling and what are the breakthroughs that you're observing?
Thank you very much. It's a great pleasure to be here today with you to mark this important moment for the changes as of January 2026. We are very happy about the introduction, actually, of the HPV vaccine, which is very important. And as in preparation for this important moment as of January, we, together with the Ministry of Health, conducted a representative research to see the behavior of the vaccination, towards the vaccination in Ukraine. Of course, from our perspective, nothing is better than the vaccination as a public health treatment and prevention measures. And this is very important, not only for the children and the family, but for the whole community and the country. We are lucky to be in an era where the vaccine is widely available and accessible. Also, we are lucky to be in a country where the government is making the vaccine available for its citizens, despite the ongoing war and the challenges which the government is facing. So this is very remarkable, and I would like to thank again the Ministry of Health for this remarkable effort. So as we can see on the screen, there is a more positive attitude to the vaccine in Ukraine. So 82% of the parents and caregivers which we interviewed showed a positive attitude, and this is a very good improvement, which the previous results in 2023 was 67%, as we can see. And also we have 85% of the responded showed more confidence in the vaccines compared actually to 78% in 2023. Of course, when it comes to the HPV vaccine specifically, those results were a bit different. So although we have 80% of the caregivers and parents we interviewed who heard about the virus, but fewer than half were able to name, for example, one of the symptoms, or they knew about what the risk accompanied with this virus. And actually, we have 54% of the responders, they were unaware of the existence of the HPV vaccine. And that means there is a lot of work to do also on the awareness part for this vaccine. Also, if we go to slide 3, we know that according to our colleagues in WHO and the data they always produce globally, that 99% of the cervical cancer cases are actually caused by HPV infection. And that means many of those cases can be actually prevented by the vaccination, which now the government of Ukraine will start in January 2026. So in our actually, we have seen with the people we interviewed, the parents and caregivers, that 63% of the caregivers knew actually that the vaccination is primarily good for cancer prevention. But with that also we can see still that there are barriers for the HPV vaccine, which are, we showed, the data shows that 42% of the people we interviewed, they said the vaccine is too new. We have 38%, they lack information about the vaccines. And we have around 29% where they have some safety concern about the vaccine. I think this is more related as well to the fact that they consider it as a new. So that means we have still work to do to support this important development. So we need to pay a special attention to the parents and caregiver for children aged 12 to 14, because we have seen in this research that they have still low confidence regarding vaccination. So only 44% hold a positive attitude toward vaccination. And they mostly expect that doctors will be proactive and contacted them. And that's of course highlight the needs and the important needs for proactive communication intervention and reaching out to the family. And with that, I think our message to the parents of the children between 12 to 13, 14, please go to your doctor and start the vaccination as of January. This is very important. Our message for any parent in Ukraine is important to make sure that the vaccination for their children is updated, and they need to leverage on this important moment in Ukraine. We thank all the partner, Ministry of Health, the partner, everyone who is working in the health sector for the dedication to, although despite all what's happening and all the pressure on the health system during the war, they are still able to provide this important prevention measure for their children. Thank you.
Thank you for this information. Mr. Ayadil, ми вже почули.
Mr. Ayadil, we've already heard that in the vaccination calendar there is already an HPV vaccine. Ukrainians are already prepared to get vaccinated. But can you please tell us about the global experience? Which countries have already included that vaccine in their vaccination calendar? And what is the place of the HPV vaccine in countering those kind of diseases?
The colleagues from the Ministry of Health, from the Ukrainian Public Health Center, from Medzakupivli, and from our long-time partners in UN systems such as UNICEF for supporting introduction of the new vaccine and changes to the national immunization schedule in Ukraine that are about to be introduced as of January 1st, 2026. The vaccine against human papillomavirus has been introduced back in 2006. So it's almost 20 years now that the vaccine has been introduced. Since then, the vaccine is being used in 159 countries around the world, of which, of these 159 countries, 87 countries follow the recommendation of WHO of injecting one dose of the HPV vaccine to the girls, and 85 countries use vaccine for both boys and for the girls to be vaccinated at the age between 12 and 13. The vaccine can be introduced in children above age of 9 years old, and from that time, from 2006, there have been almost 500 million doses of vaccine that have been administered to children around the world. Most of the countries in the European Union, United States, United Kingdom, Canada, and other countries in the world use this vaccine in their national immunization schedule for quite some time now. As Dr. Kuzin said, it's a high time. It was a high time for Ukraine also to introduce the HPV vaccine, but due to known circumstances, it has been a bit delayed. But now we are also very pleased that the vaccine is being introduced, because the infection that is caused by the human papillomavirus is one of the most common sexually transmitted infection, and unfortunately, every year around the world, about more than 350,000 women die from the cancer related to the HPV, and more than 600,000 people around the world are getting infected and getting the cervical cancer because of the exposure to different types of the HPV virus. And there are 3 types of vaccine that are being licensed in the world. There is 2-component, 4-component, and 9-component vaccine, or we call it 2-valent, quadrivalent, or nanovalent vaccine. And this is being licensed by the national regulatory authorities as well as the World Health Organization for use around the world. Thank you.
Thank you. Пане Олеже, надзвичайно важливо, щоб у людей був доступ до цих.
Mr. Oleg, it's important for all of the people to have access to those vaccines. For what I understand, if this vaccination comes up in a vaccination calendar, it means we already have some amount of those doses in vaccine. Are they already procured, and will Ukrainians be able to make use of them? Well, what we've procured is a 9-valent HPV vaccine. It was manufactured by Mark Sharp and Own, an American company. The vaccine was delivered to Ukraine about a month and a half ago. It it underwent full in-processing, including laboratory analysis. Last week, we've delivered the vaccines to all of the centers for diseases prophylaxis. We were unable to deliver to crematories due to a security situation, but that will be done next week. Then the centers will distribute them among the healthcare institutions, which will implement the vaccination campaign. When it comes to distribution and delivery, the distribution was done in compliance with the procedure approved by the Ministry of Healthcare, and in cooperation with the Center for Public Health, we were able to exercise the distribution and supply of the vaccines to the regional centers. So in future, some regions are going to get vaccinated more intensely, some less. So what was done to ensure uninterrupted supplies to those regions where the need will be the biggest? Look, we've procured the vaccines under the managed entry agreements, and thanks to the direct negotiations with the manufacturers, we are able to achieve the price, which is 3 or 4 times cheaper than in retail. So when it comes to regularity and consistency of supplies, our agreement is 2-year, and for the time being, the full need for the budget of the year 2025 was delivered, and under the budget of the year 2026, next year, we will be able to deliver the necessary quality, which will ensure the coverage of all of the goals. The managed entry agreements, what is their role in this uninterrupted process of supply? What is the managed entry agreement? It's a mechanism used in many countries of the world, in many countries of Europe. And we get a task from the Ministry of Health for medicine that underwent the full cycle of study. And then we enter into negotiations with the manufacturer. And based on the amount, we are able to achieve lower price. What are the benefits for the patients or for anybody who needs innovative medicines? Because we talk about innovative medicines that don't have biosimilars or generics. So the patients get access to the innovative treatment. That's the biggest benefit. Thank you. Mr. Oleg, let's take the perspective of the Center for Public Health. What's necessary to make sure that the supply of the vaccines is uninterrupted, and who will be responsible for making sure that the vaccines are available in the regions? Well, basically, we need to understand that implementation of any innovations may face certain difficulties of organizational or administrative nature. That's why, in cooperation with WHO and UNICEF, under the guidance of Ministry of Healthcare, we were launching a number of preparatory seminars during which we were covering different innovations, the matters of responsibility, and other things. For the time being, in every region, the use of vaccines and implementation of the vaccination programs is a responsibility of local administrations, but at the same time, there are specialized technical people in the centers for disease prevention who guide this program. What does it mean to guide this program? They create certain provisions at the level of the region, and they can react in case there is some deficit emerging in either place. And in any case, we prioritize certain healthcare institutions where the program will be launched. And also, it's a matter of a data management and quick response to the changes that are taking place. On my end, I can emphasize that for the time being, as Mr. Oleg has mentioned, we have certain reserves that allow us to start this program in the beginning of the year 2026. We have mechanism in place that ensures proper regulation of this process, either expediting or responding to certain challenges. Also, next year, we are going to support challenges in the system of registration and documenting of vaccines. And it's a very complicated and very large piece of work that who are medics and the patients will be facing. And what's most important, we need to understand that changes are taking place during the war. That's why we have this unpredictability factor that we will all have to overcome together. And I'm urging both medic specialists and the patients take it with understanding anything that may come up during this process, but we will definitely overcome any obstacles and win. Thank you, Mr. Volodymyr. I wanted to add a little bit of retrospective when it comes to vaccination coverage, the way that the medical system continues operating during the times of the war. Where did you succeed, and where did you? What would you like to improve? Well, the system demonstrated its efficiency. The vaccines are a kind of products that you need to keep under conditions of lower temperatures, but the healthcare system continues operating during the time of the power shutdowns. We were able to create a network of premises in every healthcare institutions where the vaccines can be stored even under the conditions of power shutdowns. Also, there is understanding on part of the medics and the patients themselves. There is a realization of the fact that the safety and security is achieved by vaccination as well. And the figures that our colleague from UNICEF has just presented, they are the evidences of improvement of situation. I think that's the result of our joint effort. And on top of that, we have the procedures. I cannot say they're stable, but we have protocols. We have understanding of how to ensure the uninterrupted nature of vaccination in case some unpredictable situations related to the war emerge. So we can use those tools. We can better manage those facts. Obviously, different unpredictable things happen, but we already have tools in place to respond to them. Thank you, Mr. Volodymyr, and I would like to ask our technical team to have Mr. Fedir joining us, and we'll discuss some practical things with him. Mr. Fedir, good afternoon. Good afternoon, dear friends. So today we've heard the information that starting from the 1st of January, there will be combined vaccines added to the vaccination calendar. Please tell us what does it mean and why were they added to the calendar. Let me specify it a little bit. What is a combined vaccine? If a vaccine creates immunity against 2 or more infectious diseases, like for example, measles, mumps, that's already a combined vaccine. And starting from the 1st of January, when the updated vaccination calendar comes into effect, we get more opportunities to use the so-called combined vaccines that protect against 5 or 6 infectious diseases, so-called penta or hexavalent vaccines, because we are already using combined vaccines, but we face a number of problems. And when it comes to those problems, vaccines as a medicine is a very specific product, and we have to take into account the market supply, what is available for us. To what extent can we ensure coverage of the patients with the vaccines? If we check the effective vaccination calendar, for example, we have vaccination in 2 months against 6 infectious diseases. And for example, at the age of 4 and 6 months, there is a vaccination against 5 infectious diseases. For example, in one case, we cover hepatitis B and another hip infection. Again, taking into account the fact that Ukraine is switching for the use of inactivated poliomyelitis vaccine at the age of 6 and 18 months, that contemplates another additional injection. And in order to reduce the injection burden and so that we are flexible and we can use different global up-to-date practices, it's easier for us to use penta or hexavalent vaccines when children come to us at 3, 6, 9, and 18 months of age. So their application in the vaccination calendar makes it more flexible, and we can use penta and hexavalent vaccines, and to reduce the injection burden and to make parents more open to vaccination so that they protect their children through vaccination against infectious disease in a timely manner. Thank you for clarification, but I think the parents may come up with the question, if the vaccination has already started under the effective calendar, what the parents should do? How do they switch to the new calendar? What should they plan for? Well, the answer is plain. Just contact your family doctor, use different resources, including National Immunization Portal that provides a lot of explanations and clarifications for the parents. But first of all, we're talking about the contact with your doctor, whether pediatrician or a family doctor, and in coordination with Public Health Center and the National Expert Group on Immunization. There is already a frequently asked questions list. It contains more than 100 questions when it comes to the updated immunization calendar. The parents are also coming up with the same questions, and there are answers provided to those questions. What should we do if our child was already vaccinated under the old or the effective calendar, and now the new calendar is coming into force? So if your child was already vaccinated with 3 doses against hepatitis type B, we have the vaccines available in necessary amount, but probably your child doesn't need it at the age of 24 months. Thank you very much, Mr. Fedir. Dear colleagues, if you have any questions to our guests, please raise your hand and we will pass the microphone to you. Well, we're not seeing any hands, so to finalize it, let me ask a question. Mr. Ihor, is changing itself, the vaccination calendar, but what's very important, probably not most important, but still very important, that there is a human version in this calendar. What's your opinion? How will this HPV vaccination influence the situation with healthcare in Ukraine? Do you expect any drastic changes? Well, if we check the statistics in Ukraine, we document 3,000 cases of cervical cancer on annual basis, and it's a progressive practice. That's a very aggressive type of cancer. And unfortunately, as per the results of the previous year, 1/3 of the women die either through improper therapy or identification of cancer on a later stage. So this vaccine is a way to prevent the development of disease that results from the stems of that HPV virus that result in cervical cancer. So for the system of public health and for the healthcare system in general, it will result in reduction of cervical cancer cases in a medium or long-term perspective. Definitely we cannot say that we will achieve results in 2 or 3 years, but I would rather say it's a matter of 20 to 30 years, because we're only just starting to vaccinate the girls at the age of 12 or 13 years. They will start living their sexual life on the later stages, and the population effects will be visible after 15 or 20 years of application of vaccine. But it will definitely result in reduction of spending of the government budget, and it will result in reduction of a number of overall cases and lethal cases of cervical cancer. Thank you very much, Mr. Ihor. Thank you very much, dear guests, dear speakers. Let me remind you that we were discussing the national immunization schedule that are about to take effect on the 1st of January 2026. And as a media center, we want to wish you happy holidays and see you next year.